Morning Snapchat, Jack O'Connor here from MSD Animal Health. All this week we'll be taking over That's Farming Snapchat, and in conjunction with XLVets we'll be bringing you a day in the life of a vet. What you can expect is me shadowing vets from the XLVet group, and you'll see typically what their day consists of, what time they start at, what time they finish at, etc. So stay tuned, because at the end of the week we'll have 3 questions on the Saturday for a competition, and the correct winner will receive a nice little hamper that we've put together, so you can check that out on our Facebook page. First up, I have a 3-hour drive from Wexford down to Kerry, down to Donal Murphy, so stay tuned.
Okay, my name is Donal Murphy. I'm a partner here in Sliabh Veterinary Centre in Rathmore, on the good side of the Kerry Cork border. We've assisted practice in Kinmare, the local vet in Kinmare, so we've 2 vets here, mainly large animal practice and mainly cattle. We see sheep during the spring and not a lot other than the spring, so it's mainly cattle here. It used to be predominantly dairy. It's probably more suckler than dairy now.
So this is Donal's practice in office. And Donal, you want to talk us through who works here and how many people operate in this practice?
Well, we've 2 vets here, myself and Noel Ryan, partners here. We're operating from this building since 2000. We've 3 lay staff here that work different days. Today happens to be bank holiday, so the office is not actually open today. One of the big changes I would have seen in veterinary over the past 10 to 15 years is the demise of bank holidays, which is a good thing, I suppose, from our point of view.
Yeah.
10 years ago, bank holidays were very popular days, very demanded days for testing and stuff, whereas now the bank holiday farmers seem to use the bank holiday like everybody else does. It's more of a leisure day.
Right, so Donal, typically what time would you get up on a typical morning?
There's no typical morning.
Right.
Generally, I try to be in the office from 9 to 5:30
Okay.
every morning. That's when I meet my reps with a small animal clinic from 9 to 5:30. This morning I was called out a bit early, a ewe lambing with triplets, and from a vet's point of view, that's a nice call, because once you can figure out what legs belong to what head, it's an easy lambing. A single lambing is usually more difficult because the lamb is bigger and you might finish up doing a section. So nice handy one to start today. Triplet lambs, 2 alive, 1 dead.
Brilliant.
The fish will be that now, but she don't want to go near. She can't get her to the car. And now she would.
No.
That's it now.
Okay, so this being a bank holiday, things are a small bit later, so that things are beginning to hot up now. So we get a good few people bringing calves to the clinic, calves with scour that need to be dripped, whatever, things like that. So from a time management point of view, it's much handier if you can get a few calves lined up to come in roughly around the same time. So later on this morning we'll have a few calves coming in here. We're heading now across the border into Cork to what sounds like coccidiosis in a calf. And coccidiosis, it's a very easy disease to diagnose, but can be notoriously difficult to treat. So we'll have a look. What age is this calf? Sorry.
In 1 month, yeah.
This calf is a month old and has coccidiosis. Coccidiosis is easily diagnosed. Tail lifted, straining, passing blood. Sometimes can be very difficult to cure. There's a few products on the market. One has been tried already and hasn't worked, so we're going to change the treatment I'm going to give him an injection of a sulfonamide drug, put him on injections for a couple of days and give some more reposers as well. So that was a case of coccidiosis, and as long as I'm in practice, coccidiosis is common. There's been various treatments over the years and they all seem to run their course. At the moment we have diclazuril and toltrazuril products, and the way it seems to be around here is that some of these products work on some farms and not on others, so it's a case of finding which product works on a farm and sticking with it. And the incubation period of the coccidiosis is 3 weeks, so that means if a calf picks it up the first day of his life, he's going to have disease in roughly 3 weeks. So as a preventative on affected farms, we would be recommending going in with whichever one of these products works on your farm at the age of 17-18 days in affected herds. Born when?
Last night.
Right. This calf was born last night, and he's a very lucky calf because there's a hernia at the umbilicus, but the gut contents are still kept inside the little bag, so it hasn't broken, which would mean that the guts would be all over the place, and his back legs could get stuck in them or whatever. So we'll just try and put them back in and put on a little stitch. The intestines have gone back into the abdomen, lucky enough to get them in easily. Sometimes the calf will bellow and force them up against you, so luckily enough they're gone back in, so I'll just put one stitch there just to make sure that they stay in. This is a calf with acidosis, and I'm going to give him a drip with some bicarbonate in it. We drip calves for two reasons, usually for scour where they're dehydrated, and also for acidosis. The squeamish mightn't like this. I like to cut the skin so that I can get down easily on the vein. Often when the bicarbonate starts to flow in, the calf starts to lick its lips the way this guy is doing. We usually take that as a good sign. Large animal surgery, and we would do a lot of our surgeries in here, especially elective surgeries like displaced abomasums. We would do some cesareans here where the facilities on the farm mightn't be suitable, and where a farmer can easily transport the cow with short notice. And bull fertility testing, we do a lot of it here as well. So just a simple crush, and we make good use of it.
Very good. We're off again to another call.
Okay, we're heading now to a dairy herd where we've recently diagnosed Mycoplasma bovis in a joint, and it's a problem we're seeing more and more of, and to be honest, I'm learning about it, so there's a couple of more cows lame now, so we're just going to go and have a look at those.
Perfect.
There's a few cows lame here on this farm, and this one badly lame on the back leg, and there could be digital dermatitis involved, and there's definitely foot rot or foul in the foot. You can see the swelling and very, very sore between the two crubine or the two claws.
Yeah.
So antibiotics should sort this one.
Perfect.
This is a second lame animal. and I've just cleaned off the 2 claws, looking for a potential place where we might find a white line abscess. There doesn't seem to be any. I can't see any foot rot between the claws, but she's sore and swollen here, so I sort of assume that's infection also, a bit like the last one, except the skin isn't broken. The front legs are usually more difficult to deal with, so there's no sign of foot rot or foul. I'm just going to have a look at the 2 hooves. So in the back leg, it's almost always the outside claws affected, whereas in the front leg, it's more common in the medial claw. Because I can see moisture. I can see moisture from pus.
Yeah. There you are.
There's the trouble, there's the abscess.
Right, all.
This is the 4th one now. I've just looked at the 2 claws. There's no sign of any abscesses or drops. So there's a swelling here in between the claws. Very sore when I touch it. Smelly, so that's another foul in the foot. But yeah. These lame cows now that have the foal, or as we call it in this part of the country, foot rot, I'm giving them non-milk withhold cephalosporin XNL, a great product because it goes everywhere in the body except into the udder, which is great if you have a milking cow. So there was a dairy farm where M. bovis, Mycoplasma bovis, was recently isolated from a swollen joint, and when he rang this morning that he had 4 or 5 more lame cows, I was sort of worried, but as it happened, 3 of them were foul in the foot. One of them was a drop, and so thankfully no more M. bovis. Mycoplasma bovis is very difficult to treat because a lot of antibiotics work on disrupting the cell wall of the bug, and this M. bovis doesn't have a cell wall, so there's not a lot of antibiotics work against it, and it's we see it as an increasing problem, especially in the last 12 months. This calf has septicemia, was born a couple of days ago, and picked up a severe infection after being born. I treated him yesterday, going to give him a drip today and put some antibiotics and anti-inflammatory in through the drip. This calf, a skull calf, was born on Mother's Day. So that's 8 days ago. So he's very severely dehydrated. You can see the space between the eyeball and the eyelid. I'd be estimating he's 14-15% body weight dehydrated, so he needs a drip. Okay, so earlier on this morning we saw where acidosis was the primary problem. With calves with skull, it's complicated by acidosis also, so they have dehydration and they have acidosis. And the acidosis, it's twice as bad in suckler calves as it is in dairy calves. It's twice as bad in calves 8 days or over than it is in younger calves. So this is a suckler calf who's 8 days. So I'm putting in a good dollop of bicarbonate, just spiking the drip, adding it to it. doing now is the calf that we're dripping. I'm just trying to find out what agent is responsible for the scour. So this is a very quick test. I've just taken a sample from the calf. This will check for E. coli, rotavirus, coronavirus and cryptosporidium. They would be the 4 commonest causes of calf scour in the calf under 2 weeks old. Around here, it's nearly always rotavirus and crypto, especially in a calf of 8 days old, which was the first 48 hours I'd be fairly sure it would be E. coli. So in about 15 minutes we'll have a result on that.
Perfect.
Giving some oral fluids as well, because this calf is fairly severely depleted. Okay, so a question has come in there about the needle that I was using for the drips, and the difficulty of getting a vein. So it's a 12 gauge catheter. It's the blue one. There's a couple of lengths in it. I like the long length. I like to cut the skin over the vein, and I use a blunt scalpel, fairly blunt, because a new scalpel you can just go a little too far and nick the vein. So I just like to expose the vein fully, and it makes it far easier to get the catheter into the vein. If the animal is severely dehydrated, what helps a lot is to get the farmer to just lift up the back end of the calf so that the blood sort of congests towards the front, and it makes it easier to get the vein.
Perfect. Now done.
This cow lost a good bit of blood. She cut her teeth, so that my first worry is whether she's bled out or not. But I can see from her mucous membrane that it's good and red, so she hasn't suffered a huge amount of blood loss. Okay, this cow badly cut one of its teeth, lost a bit of blood. As I said already, I'm not too worried about the blood loss. She has all the signs of an acute mastitis brewing, but I yet can't see the signs of mastitis in the milk. So I assume that there's mastitis coming on. So I'm going to give intravenous antibiotic, anti-inflammatory, and pump her stomach with fluids and some of this restorative sachet.
Perfect.
All right. I'm just pumping some fluids into the cow now. It's a very quick way of rehydrating a cow. Yeah. I don't do it too quickly. I sometimes find that cows react badly to that.
So we're just back into practice here now after lunch. A lovely dinner there with Donal's family. So we had a very busy morning, and I was meant to say earlier that if you have any questions for Donal about any of the things that you see in the videos, do write in, and I'll get Donal to answer as many of them as I can. So now we have a few more calls to do here this afternoon, so stay tuned in and keep an eye out on possible questions that I might have for the end of the week.
Okay, the calf with scour, there's a number of these test kits on the market that test for the 4 common causes of scour in calves, which would be E. coli, rotavirus, coronavirus and crypto. And this calf is positive for rotavirus.
Perfect.
So this cow is supposed to be calving in the middle of May, but not really showing any signs of springing, and I can see on the scan that she's having calf, so she'll probably get the one-way ticket. She'll probably be caught. This cow is a cow that's been laying before, and there's a crack gone right into the quick, so it's a case of just clearing her every so often just to keep her going. So this cow, the one claw or crubine as we call it around here, is grown much too long, so every so often it just has to be corrected. I'm going to cut off the toe and just straighten out the hoof. This hoof is a bit misshapen, a bit overgrown, so maybe twice a year that'll have to be just clipped or whatever to bring it back to normal shape, and she'll work away fine then for a few more months again. Yeah.
Lamb like she's drinking.
She's hungry.
And what's the name of those mountains? Yeah.
They're the Paps.
The Paps and the one in front of us?
Paps. That's Caherbarn Mountain.
Right, very good. Right, Donal.
We've 3 calves here, and 3 of them with smallish problems. This one has an abscess in its ear. You can see that the ear is hanging down. When I put my finger in, there's pus. It's after bursting inside, so there's pus coming out of my finger. So antibiotic will clear that up. This one has a little abscess in the jaw. It happens in calves when the cheek teeth are erupting. Antibiotic will hernias or abscesses, and this is an abscess, so I'm going to lance that.
Very good.
Find the soft point. Nothing on the left, very little on the left over it. So on the last farm, scanning suckler cows inseminated in the last 6 to 8 weeks. Disappointingly, quite a few of them aren't in calf, and are not cycling either. So probably weather related and feed related.
Right, so Donal, I've been with you since 9 o'clock this morning, and it's now coming up to 6 o'clock. So, what's your favourite part of the job and your least favourite part of the job?
I suppose if I start with the second half of the question, the least favourite part would be the fact that you're never really finished. You know, mobile phones were fantastic for vets, but offer the advantages to them, but the disadvantage that you're reachable nearly the whole time.
Yeah.
I'm not a guy that turns my phone off. I'm too involved in other things in the parish, so my phone is really never off. So, so you're liable to be called at any time, and that's probably my least favourite part of it. My favourite part of it would be variation. You're not stuck in traffic jams. You're out driving through lovely scenery.
So Donal, you were saying about the scenery is a bonus with the job. So
I tell you, I mean, the 12 months of the year things are different. 4 seasons, they're all different. So I like driving around. I like the countryside. I mean, like meeting the people. Like having the crack. Slagging about GA. We'd be calling it about 10 or 12 GA clubs, so there's always something to be slagging about. That would be my favourite parts of it.
very good.
So we've 3 calves, a couple of days old here with scour. Unusually, they're all running temperatures, so it doesn't look like one of the usual scour bugs. So I'm going to give oral rehydration to all 3, give them antibiotics, give them anti-inflammatories, take a fecal sample to try and figure out what's causing it.
Very good.
Okay, so that's it's 7 o'clock now. That's the end of, I won't say the end, but we're up to date in a typical spring day. You just never know what's coming from one minute to the next. So from Luachra in East Kerry.
Yeah. Very well. And from MSD, we just like to thank you as well for participating as well, Donal. So, and tune in tomorrow now, where I'm heading over to Limerick to spend the day at Brian Ryan in Mulcair Vet Clinic.